My name is Kim, and today we're here to talk about chronic pancreatitis. Chronic pancreatitis. Chronic pancreatitis is defined as the continuous inflammatory and fibrosing of the pancreas. There are two different forms of chronic pancreatitis: obstructive and non-obstructive chronic pancreatitis. Obstructive pancreatitis is often caused by inflammation of the sphincter of Oddi, which is often associated with cholecystitis. Cancer is another possible cause of obstructive pancreatitis. This is an image of the most common location of obstruction with chronic pancreatitis. Non-obstructive chronic pancreatitis results from inflammation or swelling and sclerosis, also known as hardening of the tissues, most commonly in the head of the pancreas or in the pancreatic duct. The progression of fibrosing leads to the destruction of pancreatic cells. The fibrosing cascade, or the process, is initiated by an injury to the pancreas. A variety of different cells in the pancreas could be damaged depending on the factors contributing to the injury. An injury causes activation of stellate cells into myofibrous blast-like cells. These are just fancy cells that cause hardening of the pancreas. The exact pathophysiological mechanism that causes the initiation and maintenance of this fibrotic tissue is poorly understood and unknown. This is an image of what causes pain and how chronic pancreatitis happens. You can have inflammation, obstruction, cell death, and cysts that develop on the pancreas. After the initial injury, necrosis, which is cell death due to external factors like damage, or apoptosis, which is natural cell death of the tissue, is common and leads to growth factor release. This growth factor release is mediated or caused by either inflammatory cells or pre-existing cells. The next step in the pathophysiology is the development of fibrotic tissue. The remaining tissues are affected, and the architecture and function of the pancreas tissues are affected.
Common tools to diagnose chronic pancreatitis include a transabdominal ultrasound, endoscopic ultrasound, a magnetic resonance cholangiopancreatography, also known as an MRCP, and a computerized tomography, or a CT scan. An MRCP is a non-invasive procedure where the patient is slightly sedated before lying inside a cylinder-like tube. Then the technician injects a dye into the patient's veins, which helps to better reveal the image of the pancreas, the gallbladder, and the pancreatic ducts. A CT scan will reveal 3D images of the client's organs. Both the CT and the MRCP scans are set up to reveal the extent of the damage that's taken place to the pancreas, the ducts, and the gallbladder. If chronic pancreatitis is the result of long-standing inflammation caused by gallstones, then the transabdominal ultrasound will be performed. During this procedure, a technician glides a handheld device across the client's abdomen. Sound waves coming off the handheld device will bounce off the images of the gallstones during the ultrasound. Similar sound waves will bounce off images of the pancreas, and calcified or deformed bile ducts in the presence of chronic pancreatitis during an endoscopic ultrasound. During this procedure, the doctor will insert an endoscope, which is a thin, flexible, lighted tube, into the patient's throat, through the stomach, and into the small intestine. Then they will turn on the ultrasound attachment to the endoscope, which produces sound waves to create visual images of the pancreas and the bile ducts. Occasionally, blood tests, such as an IgG4 to assess for autoimmune pancreatitis, can be used to diagnose chronic pancreatitis, but they're not typically used to make a diagnosis for chronic pancreatitis.
Okay. Clinical manifestations for most patients first presenting with chronic pancreatitis is an abdominal pain. 96% of those early onset idiopathic pancreatitis present with abdominal pain compared with the 77% with alcohol-induced disease and the 54% with life-onset idiopathic chronic pancreatitis. Okay. Eventually, the pancreas may not be able to produce insulin at all, leading to type 1 diabetes, which can produce the following symptoms: thirst, frequent urination, intense hunger, weight loss, tiredness, and blurred vision. As the disease progresses, individuals may experience pancreatic fluid buildup in the abdomen.
The prognosis of chronic pancreatitis depends on many different factors. Some of the prognostic factors include a patient's age at diagnosis, a patient's alcohol consumption, and the patient's use of cigarettes. Acute pancreatitis may develop into chronic pancreatitis if the pancreas accumulates more damage throughout the lifetime. Chronic pancreatitis may also occur without acute pancreatitis occurring first. About half of the patients diagnosed with chronic pancreatitis develop pain so severe and require fluid drainage or remove part or all of the pancreas. You also may need gallstones removed or place a stent to unblock pancreatic duct, and long-term treatment is required for about 5% of these patients. Pain can decrease over many years, but pain varies patient to patient, and pain associated with pancreatitis never lessens. Pain can also be very unpredictable. Chronic pancreatitis patients are also 3 times more likely to develop pancreatic cancer than the regular population. Patients may also develop type 2 diabetes because the pancreas loses its ability to produce insulin. Survival rates of patients with pancreatitis are around 30% lower than the average survival rates. Life expectancy depends on which type of chronic pancreatitis the patient was diagnosed with. The cause of death also depends on which type of chronic pancreatitis the patient has been diagnosed with. Patients are advised to follow a low-fat and high-protein diet, refrain from smoking, and refrain from drinking alcohol. Patients may get counseling and medical assistance if quitting any of these habits is difficult. Chronic pancreatitis means the pancreas cannot make enough enzymes needed for digestion of fats, proteins, and carbohydrates. Eating foods high in this content will lead to abdominal discomfort. The patient's doctor may prescribe pancreatic enzymes that contain amylase, lipase, and trypsin to help aid in digestion. They may also receive a prescription for bile salts to help absorb fat and fat-soluble vitamins. Patients are encouraged to choose foods high in whole grains, leafy greens, and lean proteins. Patients that have type 2 diabetes will also benefit from these choices because they are low on the glycemic index. It's important to maintain a healthy weight since being overweight increases the risk of developing gallstones.
Treatment for pancreatitis requires an individualized plan focused on the patient's symptoms and goals. Pharmacologic treatment options for pancreatitis include administering painkillers, pancreatic enzymes, bile salts, and insulin to control diabetes. Since one of the major manifestations of chronic pancreatitis is abdominal pain, painkillers are given to patients. Tramadol is frequently used to alleviate this severe pain. Severe side effects include seizures, GI bleeding, anaphylaxis, Stevens-Johnson syndrome, serotonin syndrome, and mild side effects include dizziness, confusion, hallucinations, and sedation. Oh, and nausea, vomiting, and diarrhea. So be sure to report any side effects and any Pancreatic enzyme products are often given to replace the deficient pancreatic enzymes. Pancrelipase is often given as an enteric-coated tablet to aid in this deficiency and is needed for the breakdown of substances released from the pancreas. Side effects include hypo and hyperglycemia, anorexia, nausea, vomiting, cramping, bloating, and hyperuricemia. Be sure to report to your prescriber any allergic reactions, abdominal pain, cramping, or blood in the urine. Bile salts are also given to help with the absorption of fat-soluble vitamins to prevent further fat loss. If diabetes does develop during this disease process, it is controlled with insulin or oral hypoglycemic agents. Metformin is commonly used. Metformin side effects include lactic acidosis, headache, weakness, dizziness, nausea, vomiting, diarrhea, and sometimes you'll get a metallic taste. Be sure to immediately stop the product if lactic acidosis does occur. Some side effects of lactic acidosis include hyperventilation, fatigue, malaise, chills, and myalgia. Also, be sure to continuously monitor blood glucose and signs and symptoms of hypo and hyperglycemia. Other treatments may include endoscopic therapy or surgery depending on the severity of the disease. One procedure includes diverting the bile duct into the jejunum, which diverts the bile. Another procedure is where it opens the pancreatic duct and connects it to the jejunum. Pancreatic drainage procedures such as ERCP can be done to relieve obstruction. Thank you.